So I'll ask you first just to introduce yourself, what your job is, and let us know if you're from a rural place.
So my name is Kim Fairley, and I work with Centennial Area Health Education Center. And my role is a regional health connector, and my work takes me into the CAHEC region, which is eastern Colorado, in very rural and frontier counties, Elbert, Lincoln, Kit Carson, and Cheyenne. And I do live in a rural community. I live in Elizabeth, Colorado, which is currently about 1,500 people, but it's growing. And so...
Is your background rural? Did you grow up rural?
I did not. I grew up in Iowa, in a big city, in Des Moines. And yet, I very quickly, once I moved to Elizabeth in Elbert County, I was really accepted by our rural partners, which I thought it might take a little longer for them to embrace me, but it was really a nice, I got the email from Sheriff's Department in Lincoln County saying, "Welcome to the hood." And
you call it the hood?
Yeah. So it was nice because that was the goal, to be here, to be their neighbor, not being somebody from another planet trying to work with them.
How long have you been there in Elizabeth?
I have lived here for almost 2 years.
Okay. So for a city person, which I am, who's lived in rural places, which I have, how is it?
It's lovely. I think I've always had a desire to be a small town girl. It's lovely because the people from the coffee shop to the grocery store to the local police, they're all so very kind, and I needed to be very respectful of their rural roots, and so I have learned from them. You know, it's been helpful for me to just learn and appreciate what we have here, and it's been so nice to see how neighbors take care of neighbors, especially with the COVID. It's been lovely to see folks reaching out to the community, sharing names so that folks can get groceries. People are helping, bring clothes to individuals that are quarantined, and I've just seen so many neat things, especially like with birthdays and events that are going on. The local police and fire and paramedics have done the parades here in town for kids for either birthdays or graduations. And I think one of my favorite things that I discovered when I moved here was that before Christmas, the locals do a caroling parade. They have a vehicle and a kind of like a, what is it called? Those carts that you can put cars on.
A trailer?
Trailers. Thank you.
Yeah.
They drive by caroling, and that was one of the neatest surprises I found the first winter I was here.
Have you had COVID in town? Have you had cases?
So Elbert County has had very few cases. They have really low numbers, but we have had a couple of deaths, and one of them was an older gentleman, and so there was an outpouring of course, from the community to support the wife when that happened. But really, we've been very lucky, as well as the other counties that I support in my work.
Mm-hmm.
The low numbers have been very low out here.
And just in your town, how have people responded to this? Are they sequestering? Are they wearing masks? Are they going to church and sitting together or apart? Is the cafe open? Those things.
Mm-hmm. Yes, the whole town was, pretty much shut down, and the local coffee shop, which is where everybody goes, they complied, and so they were just accepting like one person at a time to go in and pick up their orders, but they were also doing takeout for anyone that wanted to call and do takeout. But that's the place where people go. They have a giant table, and they get groups that come in there, and church groups and people that do Bible study. And so the community missed that. We don't have mailboxes. We have post office boxes, so we have to go to the post office. And so everyone complies and wears the masks and keeps the distancing. But what I did notice when things opened up a bit, the first time I went into the coffee shop, when people were able to go in there and eat and visit, I walked in there and no one had a mask on but me. And people kind of looked at me like I had two heads. So it was almost like this black and white, right? One day we have the restrictions, and then the next day we don't. And but again, I just think we have so low numbers that we haven't really had to worry about.
Describe what your job is with KHEC, please, and how it's changed.
So my job is a regional health connector. And so KHEC has a unique mission, and that is to serve the rural communities with education and support for health services. And my role as a regional health connector is to work with partners to connect those clinical and community, kind of take care of that gap between clinics and communities. So connecting the clinics and hospitals and even sheriffs, and now I'm on a different project working with jails, but connecting them with the resources, helping them address the gaps that they have, as well as using, because regional health connectors have so many state and local resources. So we have state representatives and folks that we can reach out to with state agencies to find the resources if we don't have them. And so one of the examples would be that there's been lots of COVID money infused into the state in forms of grants and agencies trying to get the funding to those local agencies that need it. And so I can be the conduit to share that information to all my local partners. And I even had one local partner that she called me and she said, I don't even know what to do with this request for COVID funds. And so I coached her through that to say, this isn't just about what you need today. It's about talking with your partners with the school district to find out what they might need in the fall. Are they going to need masks if they go back into session in person in the fall? So getting creative about what we might need down the road. And so it was a nice visit, because she said it just helped give her a lot of really good ideas to identify what those needs are. Because I think a lot of agencies misunderstand that COVID funding can cover so many things where we have those gaps right now. And that may be that you need an extra computer because you're doing so much of this, video conferencing instead of in person. Just getting out of the box and thinking about that. And so for me, my work has continued. It's actually probably more so because I used to travel a lot, driving, because there's so much rural between me and Burlington, Colorado.
How many square miles is your territory? Have you figured it out?
Oh, I'm sorry, I don't know that number. That's a good question, though.
But it's a lot.
Do you know what the KHEC territory is? It is a lot.
No.
And so my average really number of miles driving each month was on the average about 900 miles per month. And so now that I'm not behind the wheel, I can spend more time having these video conferences and doing more of the back office work that is needed for such things like applying for grants and just new projects that we're taking on.
What's lost now that you're not able to be out in the field in person?
What's lost is that what worked for me when I first started my job is that face-to-face and making that connection. The community engagement was really important when I started to be able to earn the trust of the partners. And so it has been, but there's so much value with doing that face-to-face. Sending an email to say, okay, I'm going to be in Hugo on this date at this time, so I'll stop by the sheriff's department or the hospital and check in on you. And they really appreciate that. I remember the last time I was at the Hugo Hospital for a meeting, the CEO said, "Where you been? We haven't seen you much." And so, that makes me feel good because it's nice to be a regular. I'm consistent in the work that I do.
It's a good thing you'd had the chance to establish these relationships before we went to video.
Mm-hmm.
Yeah. So it sounds like a fun job. I've done some of that myself in Eastern Colorado. And I loved it when I was just out there on the prairie, dropping in on people.
Yeah. Yeah, it is. It's great. And so, that you have those spontaneous conversations that you don't ordinarily have when you're just scheduling a meeting for a specific issue or topic. The spontaneous conversations that happen when you're on site and in person are really delightful.
Yeah. So you talked about, for example, being able to connect people with or help hold their hands through grant applications, for example, and think their way through that. Can you talk about some things that haven't worked, or some of the frustrations, or wish you could do that you can't? Not even necessarily because you can't go visit, but just kind of limitations of the whole arrangement.
Of the, you mean just the work or related to COVID?
Of the work in general. We can get to COVID too, but where are the holes? What are the things you can't address, or you've been frustrated trying to address?
I think that the workforce issue has been the most difficult because the partners in the hospitals, clinics, and the mental health centers, they're so limited. They're not able to just hire someone. They really struggle to not only hire people, but to retain them. because living in the rural community is very unique, and many people just don't adjust, and they prefer the city life. And so what I have found is that working with the partners, especially with clinics and hospitals, is their time. Their time is so limited because they all wear multiple hats. And you know that because you used to be a rural provider. And so one of the challenges that we had was we wanted to provide some care coordination training in those rural settings in the healthcare field. Mm-hmm. And it was not that they didn't want to take the training. It was listening to them share with me about the logistics that it would take to get their staff to attend the training together. Mm-hmm. And it was, well, I could pull my staff from the clinic, but then I would have to backfill their positions and pay someone to work while they're in training, and then I'm also having to pay them to train them. And so with so many things that are going on with Medicaid specifically, and also Medicare, but the changes in the requirements for the new payment model. The new payment model is, that more of that. We're going to award you for, it's the value-based payment. We're going to award you for all this work you're doing, but you have to record your measures. You have to record and track improvements, and that's even more work. And so what I tried to help them understand is this training, care coordination training, will really help you with that. Because that's the whole point of the care coordination training, to share with you this model of care coordination and all of the components that they're already doing in the community health centers. And they're already doing that. They've been doing it for 5+ years in Denver metro area. And rural hospitals, this is all new lingo for them. And so I think that's been really one of my biggest frustrations. Not that they didn't want to do it, they really did.
Just like we were
just, yeah, and time and yeah.
And then specifically,
and then of course COVID.
Say more about that.
Of course, COVID hit, and then that just changed things even more for them, more on their plate. And one of the projects that, an additional project that had started, I think it's been a year now, but it's a hospital transformation project by Medicaid, and it's mandatory. And it also includes all of those measures that I've mentioned, and just a lot more work, more reporting, more things that was put onto the hospital staff all over the state, every hospital, but the rural hospitals have struggled with the time. And so just to understand how COVID has affected everything that we do, Medicaid suspended the requirements and the reports for the hospital transformation program, understanding that everybody was going to be overwhelmed with other things. So Thursday of this week is going to be our first hospital transformation meeting since COVID hit.
Mm-hmm. So you're helping to coordinate these responses of the rural places, are helping them through doing this added level of reporting.
That's what I was trying to do with the care coordination training. Mm-hmm. And I wasn't able to get into being able to get that done in order to, because it's that whole, it takes time to save time. And I really want to save you time by giving you this training so that it will help because of all the requirements that are coming down from Medicare and Medicaid. But it still hasn't happened. And so we'll see once the dust settles after COVID, if that happens. We'll see if they're willing to give it a shot.
What's your sense of the stress levels of well, first of all, how many practices and how many hospitals and how many nursing homes and other institutions just do you make contact with?
That's a really good question. Just to give you a sense of what it's like to be in a frontier county, we have in Cheyenne County, there's one hospital and one clinic. And in Burlington, there's one hospital and one clinic. Burlington is Kit Carson.
Mm-hmm.
In Lincoln County, there's one hospital and 3 clinics. And then in Elbert County, we don't have a hospital in Elbert County. And I don't work at one community health center. And the focus is generally generally on, but not a requirement, but generally with Medicaid. Mm-hmm. Clinics and hospitals that accept Medicaid.
And pretty much all of them do out there, don't they?
Not all of them, but most of them. Mm-hmm. And when I say not all of them, I'm thinking of Elbert County. Elbert County does have, a private clinic in Elizabeth that does not take Medicaid clients. Mm-hmm. The other work that we do is around substance use, and one of the projects that the Office of Behavioral Health has funded is mobile medication-assisted treatment units. Mm-hmm. So the medication-assisted treatment MAT. So they're mobile MAT units, and we currently have one in that is between Kit Carson and Lincoln. They come out here weekly. They also go out up to the Sterling, Julesburg, and some of those locations in northeastern Colorado. And the reason that I bring that up is because I have these projects that I'm working with the jails now. So that is one of the MAT resources available for Elbert County and Lincoln County and Burlington. The only other MAT is, I believe, with Centennial Mental Health, and their MAT services are very limited.
So these mobile units, are they training, dispensing medicines, both?
They are wonderful. They are a one-stop shop. And the Office of Behavioral Health, it's taken them a long time to build these units because they're very specialized, and they have a provider, and they're using telemedicine also to get the prescriber. And so if an individual goes to the MAT unit and needs meds, they have some meds that they're dispensing there, but typically they will prescribe and give them a prescription, and then they will make certain that that individual gets to the local pharmacy to pick up their medication. Mm-hmm. And then they see them once a week. But they have, they use telemedicine to see their clinician, and also they have a nurse on board. They have peer coaches for these individuals, and then they park them. A lot of people. One of the things that's difficult in rural Colorado is to have anybody see your car parked at the mental health center. And so these units are parked either in a school parking lot or maybe the parking lot of a pharmacy, and they're just very just low key. And so
brown paper bag.
Yeah.
What's your sense of how people are? Well, healthcare providers, first of all, how people are doing out there with the pandemic. Just how are they getting along?
I do have to say, and you would know this, but rural providers and healthcare workers are very resilient. And they do this in their hometowns because that's just who they are and they love it. And they are very responsive. I think that they're making it through just fine because we haven't had the cases, and it's also been a great opportunity for them to leverage the resources that they have. We have a couple of hospitals that were PPE was donated to them through agencies. One of them, I believe, was a gas and oil company. And so they really have been able to reach out rather than say, well, we don't have the supplies, we don't have the services that we need. They were just able to be very resourceful and reach out and get what they needed. So I think that they've been pretty resilient.
Now, as I recall, your background is in technology. You did computer systems and things like that, right? How is this for you?
Yes.
I mean, you didn't start out as a social worker.
Oh, that's right. Well, I've been in public health now for about 8 years. And this work, what I really feel like is that the training that I've gotten in public health and the work that I have done has just been like stair steps. It's just been, I've gained my toolkit to be able to do this work. So once I started working in rural Colorado, I felt very well equipped, and I felt confident that I could do this work and utilize my skills. And the technology has come into play, and so I can have those conversations with folks. What that means to them, and now many folks are beginning to appreciate the technology because we do have Zoom technologies, but there's also a project in the communities. We've come a long way because there's a project in the community since we have really, really low numbers as far as available clinicians for crisis. Mm-hmm. About a year ago, the Centennial Mental Health Center put into the hands of law enforcement and EMS and fire, anyone that really wanted one, was an iPad. And the iPad is for crisis services to be able to, if they have someone in crisis, they can immediately connect the iPad one touch. It's not complicated. They set it up so it's a one touch to connect to a live person, to have a clinician available for that individual that's in crisis. So I feel like I have such a good understanding, and I do have an advantage because I can talk with those folks that have the more technical job and understand what that, I can translate that. You know, I can ask those tough questions because I do have my technology background. And so I feel very well equipped to do this work.
Are the people who've had the iPads put in their hands, the police and so forth, are they using them?
They are using them. It's interesting because I think that they were a little afraid of them, but what we've also learned is that many of the folks, because and police, and the police will tell you this, and sheriff deputies will tell you, we are trained in law enforcement. Right. We're not trained to be mental health workers. Right. And yet they knew that they needed some tools because there's so many more people with mental health and substance use issues more than ever. And they're in the jails, and they know that they've told me, you know, we know that they don't necessarily need to be here, but, you know, their mental illness or their substance use got them here. And so we want to help them. And what we've seen is that there have been many, many people who were way beyond crisis. So they weren't able to even get them connected to a clinician. They had to take them to the emergency room, which is that's what they're trying to avoid. But there's just this whole new level of crisis that is happening, and especially in the rural communities. And then one of the other challenges that we see especially in Lincoln County and a little bit in Kit Carson, is that they're along the I-70 corridor. So they get a lot of transient population, folks that they're not from those counties or those communities, but they either ran out of gas, didn't have money to pay for more gas, or they're transient, or they committed a crime in Lincoln County, so they had to go to jail. So there's just a lot that happens in Lincoln County between I-70 and all the way to the Kansas border, really.
And there, as I recall, I-70 is one of the major drug conduits in the country. So
drug conduits as well as human trafficking.
So in the middle of this pristine prairie, you have these horrible problems that we thought were urban.
I had heard that Burlington, Colorado, which is very close to the Kansas border, there's a lot of drugs there.
Kim, do you want to say a little bit about the other project you're working on through KHEC on the emotional, I always forget the details, but you know what I mean.
Yes. So I have had the pleasure of participating in really a collaborative. Back in June last year, I was introduced to a gentleman who works for the Rocky Mountain Farmers Union, and he just had a real passion to try to find a solution to connect the ag population to behavioral health resources, because he himself, Rocky Mountain Farmers Union covers Wyoming, Colorado, and New Mexico. And he has seen so much suicide, as well as so many farmers and ranchers who have suffered from environmental and weather and economic, and then COVID. So many things that have impacted their lifestyle and their ability to make a living. And so Dan has reached out to mental health centers, and I was connected to him. And it was primarily because of the work that KHEC does in the rural communities. And so we have had the pleasure of working with so many great partners, including Dr. Mark Ringel. And we have a really diverse collaborative group working together to build a curriculum. And the purpose is not to just give people resources, but to train local champions and local community members who can then train other community members to be able to learn how to have a conversation with someone who's really dealing with a lot of stress, anxiety in their life. And generally, the reason that we want to train the local folks is that we have learned, because we've listened, and we have found out that farmers don't want to talk to anyone else but another farmer, because we just don't have the same experience they do. And so that's the whole point, is to train the gentleman that sells them their feed, or their barber, or their loan officer, their banker, so that they can look for signs of that stress and have that conversation. We are also very fortunate to have folks from the mental health centers who are trained in those skills such as QPR, which is question, persuade, and refer. Mental health first aid, some of those really important tools to really not only learn, but how can I, as a layperson, be able to help my neighbor? How can I, as a layperson, be able to understand that my neighbor's wife is reaching out for help because she can't help her husband, who is extremely stressed and very vulnerable. So, and then we also know that this, it's not just the stress and the depression or anxiety, but there's also substance use that goes along with that. And so the training is really to help all of that, to help identify and support and then refer these folks to get them to supportive services so that they can seek some relief. And COVID has really just, we've been working on this before COVID happened. And this, when it finally happened, we felt an urgency. We don't want to wait any longer. We really need to get this done. It was timely that we were already having this discussion. So our goal is to launch this curriculum and begin to work with partners in the communities such as the other AHECs. We hope to be able to launch the training in the KHEC region first in Eastern Colorado. And we plan to launch it by August. It may take us a little bit longer because originally we were going to do in-person trainings, and now with COVID, we have to, we need to also be able to train on the virtual platform. So very excited about it.
There's nothing new here that I'm observing, but if I could summarize some of what you've said, and you've lived an urban life, you've lived a rural life. Small towns or rural places are good places to get what you need from your community. They're not good places for encountering rich resources. That's a trade-off that I understand really well, and that I appreciate. And especially these days, when we're, it's again like this Medicaid measuring everything, and it's all about stuff and things you can measure. And what's the measure of community?
Exactly. It is. There is no price. It is invaluable. Well, I have a friend who she did get COVID, and she lives in a very small community as well. And she had to be quarantined she lives by herself with her sweet dog. But she wouldn't have made it through without her community. They were able to go grocery shopping and leave the groceries on on her porch, and her coworkers, mailed her things that she needed and ordered things for her and really supported her. And she said it just made all the difference while she was sick. And she was sick for a long time.
Yeah.
So. Yeah,
this is a tough infection. That's a tough disease.
So I did want to tell you real quick, you asked me about the technology question. And I wanted to share briefly that I went to Phoenix at the end of February to go see my dad for his birthday. And I had told my boss that I was not taking my computer because I wanted a vacation. And my son had an accident, and he lives in San Francisco. So I flew directly from Phoenix to San Francisco without my computer. And so I got really creative. With COVID, and I was going to be there for 3 weeks, I needed my computer. And so Fortunately, my daughter, who just happened to be visiting in Colorado, and she was going to stay at my house, was at my house for a couple of days. And my son, who lives in Colorado, he's a computer geek, he was able to remote into my laptop and get me set up so that I could access all of my files from San Francisco. And so I was able to move all of my files in the Google Cloud, and voila, I was able to work from San Francisco without my computer. It was wonderful.
Can you imagine how much harder this all would have been without these technologies and all of this isolation? I know.
You know, Mark, I hadn't even thought about that, but that would have been very strange.
Yeah.
Very strange, because, I mean, we wouldn't even have cell phones. We would just have those landlines, right?
Yeah. I've heard they've just come out, by the way, with a cell phone that has a dial on it. Really? Just for a novelty.
How funny.
Yeah.
How funny.
Yeah.
Do you remember the very first video phone?
Well, I had a flip phone. I didn't have a brick. Oh, that was just a cell phone. Video phone, no. Yeah, it was a little flip phone with a tiny.
I saw an article the other day that showed one of the first video phones, and it was thousands of dollars.
Oh, yeah.
For that first, and it was very big.
Well, I was in on telehealth, the video stuff, when it was first coming to Colorado in early 90s. And at that time, a station cost $25,000, and you had to rent a T1 telephone line for another $1,000 a month or something like that. And now
wow.
We just do it on our phone or on our laptop.
I mean, I just think that really, like, places like rural Colorado would have been completely cut off.
That's right.
Right?
That's right.
So, because, you know, the urban communities can, they just have more resources.
Of course.
And those communities would have been cut off, and it was, yeah. So what a blessing for us to have this technology to get through this, because it's not over yet.
These technologies are capable of promoting community, or they're capable of putting barriers between us, and that depends on how we use them. Yeah. Well, Kim, anything else you would like to say? You realize this is for posterity. Somebody looking at this 50 years from now who's trying to figure out what we were doing back in those ages.
Yeah. I think that it's been an opportunity for me as well to appreciate community, whatever that community looks like for you or for me or for, you know, the rural hospital in Eastern Colorado. And for me, it has been such a wonderful opportunity to build this community around the rural stress project that I'm working on. I didn't say the name of that, but it's the Rural Peer Assistance Network. Because we have had so many partners that have come together with the same passion and desire to support and find solutions for our ag communities and friends. And so it's been lovely to work with so many individuals. And I know that many of us have Zoom fatigue because we do this a lot now. However, I have gone from someone who used to just be very self-conscious about doing video calls to needing to have this video call. It's important for me to see you,
right,
and be in the same room. And on Mother's Day, my daughter-in-law is a yoga instructor, and they're doing yoga online now. And so they had a special yoga class for Mother's Day, and it was wonderful. There was about 15 of us, and my daughter-in-law was there, and I just felt like we were in a class together, and it was great. So,
well,
yeah,
there's that story about it was it might have been in London or in New York City. The first time they put on a movie for the public, and it was of waves rolling in from the ocean, and a bunch of people panicked and ran out.
Oh no!
So I know, but you know, this becomes a kind of reality. And you know, so.
Well, thank you so much, Mark, for taking the time. I really appreciate it.
Oh, I really appreciate it too, Kim.